Hello, my name is Kumar, one of the consultant ophthalmologists who specializes in medical retina, uveitis, and ocular ultrasound, and I work at Stony Gate Hospital as well. So I'm going to talk about management of macular degeneration, which most of you heard about it. So just give you some insight of what is macular degeneration is due to. Um, as you probably heard about what types of macular degenerations are, but I'll give you some brief about what causes or what is responsible for macular degeneration. So we call it as risk factors. So the risk factors are, as you all know, age. Aging can be one of the risk factors, something that we cannot stop. And then genetic makeup, something that part of our life. And the most other common environmental factor, including smoking, which is the commonest cause, and immobility and COPD could be an independent risk factor, and cardiovascular disease. Again, although it's not completely proven to be, but it seems to have some relation to it. Now, these are the risk factors which can cause either a dry or a neovascular macular degeneration. Most commonly, these factors contribute to neovascular macular degeneration. As I've told you, there are two types of this problem. One is a dry type of macular degeneration, and next one is a wet type of macular degeneration. But unfortunately, although the dry type is not so severe, it continues to slowly cause problems. But there is no specific treatment for us to stop this as of now. Although many of you might have heard there are tablets in the form of vitamins being advised by many of my optometric colleagues or even eye doctors. But there are studies seems to stabilize this problem in many patients. Doesn't seem to stop it completely. So we don't have a real end of medication or treatment to completely stop this problem. However, this tend to be milder form. But what we worry about most is the neovascular macular degeneration, that's wet AMD. Now that's a concern as it causes sudden loss of vision. You find sudden onset of black spot in the eye, which has happened to be, and you lose your vision quickly. Now there are treatment for this. I can tell you what the treatments are. So these are injection forms. Yeah, you might have heard injections in the eye. Yeah, it might look alarming, sound alarming, but you'll be surprised. Most people will not feel much of discomfort at all. It's just a sharp scratch sort of feeling. Most patients who had this injection will reassure you it's not painful at all. Now, what are those treatments? So as of now, 3 drugs has been licensed. You can give them in a fixed dose fashion, so like every month or so. Next one is sort of interval based. Suppose you can't come on time, so you just face the interval break. Or so it's called treat and extend. I'll tell you the reason why we do this. So some patients, 2-3 injections will stop the problem, but some patients tend to come back again and again. So sometimes we have to treat and extend and see whether you're getting better and stabilizes. And then if it comes back again, you treat it. You'd be surprised, but 9 out of 10 patients will stabilize vision. 3 out of 10 patients tend to improve vision. So just tell you about these drugs, these injections. One of the important drugs commonly used is called ranibizumab, which was approved in the European Union and US in 2007, which is about monthly interval dose, and you have to give them monthly as well if you get a recurrence of this problem. And then further later in 2012, aflibercept was approved used in European Union and United States, which you start with monthly dose, but you can sort of delay it by longer than 2 months interval, so you can prolong the interval. So the next drug is called brucellizumab, which has been approved in 2020, just this year. It has been approved in the US and European Union. It's coming into the UK as well. We're just going through the process in the NHS and also the private sector. The idea behind this is this acts longer, even up to 4 months, 16 weeks. So you can prolong these injections. So these are three available drugs, but there are various other medications being looked into. So for example, there is a drug we can just insert into the eye. It can last for a year. We just need to refill. So there are various kind of drugs being sort of looked into. So we don't have that in use yet, but won't be long. We hear about all these new advances soon. That's briefly about treatment. Like I said before, you'll be surprised to hear most will say, oh, it's just probably a scratch feeling or just brief discomfort. Nothing more than that. They just, after the injection, they feel a little bit of a dark blurb due to the air bubble. That's about it. You may not even feel that the discomfort much. The treatment doesn't stop immediately. Unfortunately, these drugs only work for a short term. Hence, we may have to repeat this injection. Like I said, could be monthly, could be 2 monthly, or 4 monthly. Like I said also before, there is a device being devised to work longer than a year, sort of needing refilling. So this all had to come, but currently these are 3 drugs available to use in the wet macular degeneration. Thank you.
Hi, my name is Len and I am 14 and I live in Leicestershire with my family. I am wanting to speak to you about an amazing charity called Vista. I am reading from my laptop as I suffer with memory issues. Although I've only been with them a couple of years, they have really helped. My personal story begins in 2015. I was at school practicing with the netball team for a next tournament when all of a sudden I took a funny turn. I began to feel really ill. I had a migraine and was hallucinating. I went home straight to the hospital and I began to have a stroke-like seizure that lasted for 8 hours long. When I came out of the seizure, I was left with a couple of extra needs, one being vision loss, although we did not know this at the time. So on the 18th of December 2018, I got diagnosed with visual impairment. So for 3 years, I had a real struggle with falling into roads, often spilling a lot of drinks and leaving a mess wherever I went without realising. I struggled to see anything that isn't directly in front of me, and I have no peripheral vision. I also struggle to see depth and colours that are not contrasting. After I got diagnosed, my family discovered Vista. They have helped me so much. I am now a long cane user and I'm proud to be so, thanks to Vista. We go on outings to all sorts of places like the Snow Dome, and we sometimes go out for a meal. We also do stuff closer to home, like talent shows and cooking and lots of independent skills. Thanks to the support of Vista, it's helped a lot of my confidence grow and helped me become a happier and more sociable person. I've made lots of new friends that are a lot like me. Please make a donation today to help a better tomorrow and a brighter future for someone like me. Thank you.